Hi everyone, Alexandra here with MDPen. Thank you guys so much for tuning in for today's video. I am here with Angie. She is the CEO, owner of Angie's Day Spa here in Edgewater. She has another location in New Smyrna. She is an RN, and they recently have added the EndyMed to their practice. They are using it and will be using it for RF microneedling, also tightening, and we really want to teach advanced training today because they haven't been using it at all for advanced RF needling for acne scarring. And as you can see right now, we have our educator, Sydney, in Atlanta going to do a treatment for advanced acne scarring treatment. And when I talk about acne scarring, this really can be anything from a chickenpox scar, an ice pick scar, a box scar, rolling scar. With Angie's business here, Angie's Serenity Day Spa, they chose to bring this device into their practice because you were predominantly doing a lot of body treatments.
Correct.
So Angie has everything here from like couples massage to microneedling, and they were looking at people who wanted to get rid of stretch marks but also wanted toning, tightening, things like this. And yes, it's nice to have body wraps and massaging, but you also want those long-term permanent results that are going to produce collagen that you can also maintain. Now, of course, in other practices, they might bring in this device for other reasons. So if you're a doctor primarily doing dermatological surgeries and you're getting scars, surgical scars that are well healed that could look better, you might want to bring in a device like this. So there's different reasons why these are added to practices. And I will tell you guys in the comments, please use your comment section, whether you're on LinkedIn, YouTube, or Facebook. I will be happy to answer your questions during this video the best that I can. There will be a couple giveaways as far as products, so that will be awesome. And what I first want to know, guys, is are you considering bringing RF microneedling into your practice? And what are some of the reasons why you would want to do this? So just feel free to type that right in your comment box. You will be set up to possibly win an HA Copper Mist, one of our favorite products from MDPen, many uses with this. So right there in the comment box, let me know if you are interested in bringing the EndyMed device into your practice. Again, this is a system with RF microneedling. So when you hear me refer to intensive, that is that part of this device. Now, a little bit about Sydney's model. I was able to speak with her beforehand. She's had minor acne off and on since her teens. Recently, it's been more adult female hormonal acne. So that's what we're dealing with. She doesn't have a lot of active acne today, which is great. However, if she did, we would still be able to treat her. So that is a huge benefit of RF microneedling. I'm sure that's another reason why you wanted to bring this in, because it's so hard when you have to wait to fully clear up someone's acne before you can microneedle them. And in the case of Sydney's model, what she's been doing recently is using an LHA cleanser. She doesn't use it always every day. She uses a retinol 1% about every other night. Sometimes she actually only spot treats with it. I'm going to set up my own consult with her in the future on skincare. She has done microneedling once, regular microneedling. So she's really looking forward to this. She does have some PIH. I think the majority of the scarring that she has is going to be more the boxcar scarring, ice pick, but this is really going to help too with the PIH that you are seeing from residual breakouts. Unfortunately, as you guys know, the darker your skin type, the longer you can really hang on to PIH. So if you are someone that has, you know, a large clientele of Fitzpatrick 4 to 6, this is going to be something that you can safely offer them. So I do see someone here. Awesome. I see a response to my question. All right, from YouTube, Dr. K. Thank you, Dr. K. Please email me. You'll get the link for it to email me your info, and I am happy to ship you one of our HA Copper Mists. Thank you so much for tuning in. So Sydney has prepped our patient. She has used our hydrating cleanser from MDPen. She had numbing on for half an hour. And we're going to treat a full half of the face on this video, so that's what you'll be seeing. She did cleanse off the numbing. After you cleanse off the numbing, you do want to use alcohol. So remove any residual oil cleanser off of the skin. You want to get the skin nice and clean there. So that's what you can see her doing now. With, of course, regular microneedling, those of you that are using MDPen, we do have the HA Copper Mist in the prep. Not necessary with this. You want the skin to be nice and dry for this EndyMed treatment. So hi, everybody in the comments. I see some familiar names. So yes, we're going to prep with cleanser and then use alcohol and then get the skin nice and dry. And she's numb. She was numbed for half an hour. Just so you guys know. What I'm going to show you now is just a needle on the intensive so you can kind of see it up close. Of course, this is the system next to me, and I'm going to wear gloves because I don't want to contaminate this needle. So this intensive has 25 gold-plated needles. They are non-insulated, which means that it's going to target all of the skin. When you have needles that are more insulated, you're only reaching the skin at those dermal layers, whereas with this, we're going to reach everything all the way down. So let me just take it off first. And for those of you that have pens, this is going to be really easy too. So there's little teeth on here. This is the cartridge. And you'll see how you can just line it up and set it in here. And remember, with your MDPen cartridge, you turn left and it tightens and it locks. So does this. So it's left. And then to take it off, you twist right and lift up. Same as the pen, which is really ironic and interesting. So I've got it set right now. It is all preset. This is the pure. So the max depth on here is 3.5. And right now it's going to be preset to 1.5 forehead, which is where we start. So I do have it on forehead. I'm going to push start. And my first needle pulse just went off. I don't know how close I got to be for you guys to see. There we go. But you can see it kind of move up. And Sydney's going to always be in contact with the skin when she's pushing that pedal. You don't want to arc it or anything like that. So here she's still prepping. I do see some questions coming in. Happy to answer these. Awesome. We see a few people interested in the comments. So here's a great one. Can you treat your face and body on the same day? So I assume this is a potential patient asking this question. It's a lot for yourself. This device does not, and treatment do not have a lot of downtime. However, when you're, I would say, babying or taking care of the areas that were treated afterwards, you don't want to be overdoing things. Also with the compounded numbing, depending on the percentage that your provider is using, you don't want to cover too large of a surface area. And your provider should know that and go about it in a safe way. But it's a lot if you're treating, like, you know, we've all had someone who wants both hips done with stretch marks and then also their face. I always try to discourage that. So I would try to do body and face on different days. If it's something like neck and face, then yeah, absolutely add it on. Even neck, face, and V of chest would be okay. But when you start getting into larger surface areas, I would try to keep them separately. So awesome question. Thank you guys for asking that. How are we doing over there, Sydney? Looking good. Model's got a nice clean face. So you can see her there using those pre-settings. She's going to select. She's going to the forehead. Same thing that you saw over here. And picking up her device. I'm going to keep answering some questions here. Got a question, can you work out the next day? No, I try to tell people not to, which I know some people will not stay out of the gym or working out. If someone does and they don't listen to the practitioner, they could get irritated. Something with sweat and those new channels and healing skin can cause a lot of redness, irritation, discomfort. Day of, you definitely don't want to work out. You don't want anything that could possibly get into those microchannels. Not the day you want to garden or rip up your floors or do a lot of home repair or anything like that. So I'm going to go ahead and enlarge Sydney for you guys. She's going to get started here with the treatment. So let's zoom her in. And that's my favorite place to start as well. Start on the glabella. You can definitely test out your patient's comfort level. You can see those needles are going in with each pulse of the foot pedal. Our model looks nice and comfortable. With this treatment, it's a single pass, and typically you want to do about a 20 to 50% overlap, which you can also see her doing. So these are really nice, tight, close together passes. I'm going to go back to double screen so I can answer some questions here. How many sessions are needed to see results from RF? So even though Cleo on our last video, acupuncturist Dr. Cleo, was talking about MDPen, I completely agree that with intensive EndyMed, your patient should be seeing something by the time they come back for their second treatment. They should see some real changes in the skin, even if it's something as simple as like skin brightening. Oh, my pores look smaller. There should be something happening. And the cool thing with RF microneedling in particular is one treatment of this is going to be equivalent to 2 to 3 treatments of regular microneedling or MDPen. So you're not missing work as much. You're not going to as many appointments. Your downtime is shorter. Yes, the treatment is about twice the price, but again, you're getting 2 to 3 times the result. So that's about how quickly you're going to see results. Of course, the younger you are, the faster your collagen's going to wake up, and the faster you can see results. So I see a great question here. When using with active acne, is there a risk of spread? With our microneedle pen, we do not use. Absolutely. I'm really glad you are not using your pen with active acne. This would not be good at all. Definitely go around it if it's just a couple breakouts. The difference with this is going to be that component of heat or RF. There's actually not a lot of bleeding either with the intensive treatment or RF microneedling, because you have that heat coagulating the blood as well. So you're not getting that, ever getting that bloody type treatment. If anything, it could be pinpoint in an advanced treatment like this, just because you are at that higher depth and you're treating acne scarring. So thank you for asking that. Of course, the less acne you can get, the better. So the more you can get the breakouts under control with any treatment, whether it's MDPen or intensive, I always recommend starting with a facial, even if it's an existing client, whether it's a device facial, a deep pore facial, an acne facial, whatever you offer, hydrodermabrasion, just get things a little cleared up as much as you can before you before starting and get that in there. So great question. Thank you so much. I'm going to zoom back in on Sydney here. Treatment's looking good. So she's still on the forehead here. And there we go. Model's nice and comfortable. You can see she's doing those really nice tight knit passes there. This is a great question. What skin concern is best to treat with RF microneedling? So in my opinion, this treatment is really going to blow your mind with the results when it comes to acne scarring and also stretch marks. However, tightening, things that you weren't able to tighten with regular microneedling, it's amazing because this device also comes with, again, tightening and contouring hand pieces. So like you'll see next month in our webinar, you can treat stretch marks with the intensive right here. And before you do that, you can do a contouring, use a contouring hand piece and actually do some really nice tightening and toning. So you can use multiple hand pieces in the same treatment. Of course, Sydney's model is young, youthful, but let's say she had a lot of aging, hyperpigmentation, crow's feet around the eyes. Sydney could have also used the eye fine treatment on her at the time of this same day microneedling treatment. So you can really bundle things together. But there's definitely a huge wow factor with things like acne scarring when you're doing these amazing advanced treatments. So thank you. Another awesome question. Why is there no serum or glide? Do you apply anything after? Yes, you absolutely apply after. Nothing on here because we are working with heat, guys. So this would send a shock and it would not be comfortable. So we're creating the channels here. If we were using PRP or PRF, which we are not today, it would go on once these channels are open. And you'll see at the end of the treatment all the things that we are able to apply into these nice channels we've created. Let's see something here. Yeah, so again, she was numbed for half an hour with a compound numbing cream, which is what you'll want to use. Your physician should be able to help you with that. Use something strong for numbing. You don't just want to use like an over-the-counter 4% with this. You do want to have something stronger. So you can see the patient's very comfortable. Sydney's holding the skin nice and taut there. And again, those are really nice pre-settings every time you change. So she may have just, taken it off the forehead setting and moved it. You can really put it at periorbital when you're around the eyes and turn it down from there. There's so many options with this device. You can customize it to your liking and whatnot. I see a question. What should not be done after RF microneedling? Great question. So day of, just like regular microneedling, you are not going to apply sunscreen until the following day. Your practitioner cannot apply sunscreen in office, so you do need to go straight, home, indoors, to your office, wherever, get out of the sun. Especially in the summer, you've got to be really careful with this, guys. So typically not cleansing the skin for 6 to 12 hours. If you do want to cleanse, I only recommend using the MDPen hydrating cleanser. I'm not just saying that because it's ours. I'm saying that because this has chamomile, marigold, snow mushroom, HA. You could literally put this like into an open wound and it would not cause infection. There's no fragrance, there's no dye, there's no parabens, nothing like that. So you could cleanse. Other things you don't want to do is use anything skincare wise that your provider has not recommended. You do really want to stick to things. And for those of you that are watching from LinkedIn that are providers, you definitely want to just bundle your MDPen skincare in with this treatment. If you're, charging $800 to $900 a treatment, which tends to be around the national average for RF microneedling. And I know Angie plans to do this when they do start to offer this treatment. She's going to bundle in probably our HA copper mist and our human derived growth factor gel. This is much easier than collecting $800 or $900 and then being like, oh, hey, will you also spend $200 to $300 on skincare? So just putting it in there in advance, telling them how they're going to use it is going to be the best thing you can really do. So here we are at the cheek now. So this, of course, as you guys know, with regular microneedling, can be the most comfortable part of treatment and also the highest depth. I'm assuming, obviously I'm not there. I can't see super well, but I'm assuming this is where the majority of actual scarring is. I'm going to bring us into the solo layout here. Renee Anderson is asking for the name of the device. Absolutely. So this is the EndyMed, EndyMed, and we'll put that right in the comments. And this particular handpiece is the Intensive, which is the RF microneedling handpiece. Again, you can see those gold-plated needles. There's 25 of them, non-insulated, going right in there. She's right on the jawline. Our patient's nice and comfortable. You can see that little bit of residual active acne that's healing up there. So this is going to give her skin such a nice consistency, get rid of some of that PIH as well, which is going to be awesome. So still very comfortable, but yeah, getting right into the cheek there. I can assume Sydney's probably at twice the depth she was at on the forehead. I find with treatments, and it's sometimes similar with regular microneedling. You might be at a 0.5 max on someone's forehead, but once you get to their cheek, you may be at a 1 millimeter. you got, you know, that added collagen there. And of course, in this case, we have advanced scarring. Had this been a pen, you know, we would have had to have done multiple passes. You'd be doing your cross sections, you'd be stamping, so treating a whole section and stamping. With this, it's like you're stamping and cross hatching at the same time in a single pass. So that does make it easier on the provider. And of course, the level of comfort, you can really see it here. And again, she's pushing a foot pedal. You can preset it if you don't want to use a foot pedal, and the needles are going to keep, you know, shooting automatically. I like the foot pedal personally, but you do have that option if you don't want to use the foot pedal. I do see a question here about injectables. Is it okay to have RF microneedling treatment after getting fillers or Botox? So in general, the rules are going to be pretty similar to regular microneedling. With neurotoxins, that whole grouping, typically you want to wait 2 weeks at least, and you want them to settle. Of course, those are done at the muscle. Mm-hmm. So it's unlikely RF microneedling will affect these once they are, once the neuromodulators are injected, they do settle into the muscle. With filler, you don't really want to do any type of more superficial fillers. I won't rattle off brand names, but those of you that inject know what I'm talking about. So you don't want to do RF right after having filler done. Safely, you can, of course, do RF 2 weeks later. Fillers that are done near the bone, so deeper fillers, those are not going to be affected by RF microneedling. They settle, you know, injected very low, so this is not going to affect them. My advice, if you're doing this for anti-aging or for acne scarring, if you have the patience, go ahead and knock out your RF microneedling series. Mm-hmm. Is this what you would do, Angie? Yes. And then kind of wait, let the collagen build, let it grow, and then see where you're at, because you might not need as much filler as you thought you would. This is really going to build collagen. So that's the safest thing to do. But if you do have someone, you know, that really wants to go, just make sure you're, again, waiting. If you're going to do the treatment after, I would give the skin a full, I would say 10 days to heal after the treatment if you're looking to do some type of injectable post-treatment. So thank you for asking that. Hi guys, see some familiar names and faces. Awesome. So she's really getting moving now with the treatment at that periorbital area. Again, there is a setting just for periorbital, and you can adjust it. So her model may have said, you know, the corners of the mouth were more sensitive. You could turn it down. You can turn it up. Typically, you know, a lot of us have larger pores here near the nose. So I'm sure Sydney just turned it up there for that. And again, she's very comfortable right along the cheekbones there, getting with the passes. And similar to the pen, you can see where you've been, where you've treated. So there shouldn't be any like untouched skin. It should not look like a checkerboard. And you're doing these passes, again, at 20 to 50% overlap. So you're not going to have any untouched skin there. Oh, I see a great question. Can you use RF microneedling for hyperhidrosis? Yes, you can. So if you've been doing neuromodulator for your hyperhidrosis, I know there used to be a device on the market years ago. I don't know if people still use it. It was for hyperhidrosis. I remember training on it. It was like this huge grid and it was not comfortable. This would be an awesome alternative to that. So yes, absolutely. It's not going to be covered by your insurance, but yes, definitely can be used for that. Awesome. This is so great, guys. I'm going to zoom back in so you can get a close view here of what's happening to the skin. You can see Sydney's model here. So with the nose, stamping is going to be what you're going to do. She's holding that other side to make it comfortable. The nose does not hurt. It can tickle. It can vibrate a little bit on there. It can cause sneezing on some people. So she's really doing great there with keeping the patient comfortable and just holding that side of the nose. Great. Yeah. I see a question. Hi, Sammy D's. So Angie will be offering the EndyMed in the future. She is an MDPen microneedling customer, so can't really answer this right now. I will tell you the national average is 800 to 900 a treatment. With what you're seeing right now, it would be your decision if you're adding PRP, PRF, of course, that can add on some money. And like I said in my LinkedIn video a few days ago, I would try to make packaging as affordable as possible during the summer for your clients, and really reward clients that are coming in regularly and are, you know, true to your practice, setting up their appointments in advance and buying bundles. So great question. Thank you for asking. And when you do buy an EndyMed from MDPen, we're going to provide you with all of those suggestions and marketing and training as well. So you will know what to charge. It's really going to depend on your area. Angie and I both kind of live outside sleepy beach towns. So of course, it's growing here for sure, but it's not going to be the same as if you're on the Upper East Side of Manhattan. So, and here you've got the beach, and it's hard to keep patients and clients out of the sun. So, the ones that are willing to do it, you definitely want to reward them with, you know, excellent pricing. So, looks like Sydney's asking her how she's doing. Very comfortable. Awesome. We got the thumbs up from both. Yay. So if you guys are finished with the one half of the face, if we can just show like what you're going to apply. Of course, I have the bottles here too. We always recommend immediately following any RF microneedling or regular microneedling using the HA Copper Mist product. She's got hers too. Yay. So this isn't just HA and copper, it's HA, copper, zinc, and manganese. And I love this product for acne prone skin, oily skin in particular. That zinc is going to help with balancing oil control, sebum production. It just sits right on the skin there, very low molecular weight. Sydney's gonna tap it right into the skin. I love that technique. And with this one, your patient just needs to close their eyes and mouth, and you can just mist directly over. You don't have to be super close to the skin. And now that she's done that, she's going for her next product, which is our human-derived growth factor gel. So that's the really nice back bar size you want to get as a provider. This is one of the retail sizes I'm showing. This is what Angie plans to include in her bundles for her patients. And you want to get it into those micro channels early on. We call this our PRP in a bottle. It also has HA and snow mushroom. And because it's a gel, this is going to be extra soothing. It's going to be thicker, so they're going to feel like they have a really nice moisture protectant, especially to get them home until they can keep reapplying. And the HA Copper Mist is going to be ideal for first day reapplication. They don't have to touch their face. So every couple hours, just misting the area down, and then also applying the growth factor gel. Both of these are everyday skincare products as well, which I always talk about in other videos. But yes, these are the two we are applying. Post-treatment, our model will be gifted with product to use after the treatment, and that's what she will do. I'd recommend she not cleanse until this evening. If this were a late afternoon treatment, I wouldn't have her cleanse till the next morning. Yeah. Next morning, so she can just wait. And if your patient's, you know, nervous about cleansing their face that day, they can wait until the next morning. But I know people with acne, and myself, I'm pretty oily, and it's really hard for me to not cleanse my face twice a day. You're really asking a lot. So let's zoom in, guys, so we can really see. I'm going to enlarge to the solo layout. Again, there's not a lot of pinpoint bleeding with this treatment because you do have the heat. You can see the half of the face that's untreated. She is looking amazing. She's going to have minimal downtime for sure. Typically with the more fair you are, the more of that like tomato red you could possibly get. So she's not going to have, you know, a ton of redness. Since I am talking about product, guys, I'm putting that promo code up there. If you want to go shopping on our website, there's that link, save 10% with the code. We also have some great kits up there. So definitely check that out. I'm going to talk more about the aftercare. Thank you guys so much. Thank you, Sydney. I hope your model enjoys her treatment, enjoys her results. I'm going to get both of us back up here. And her model is going to get a full face treatment. Don't worry, guys. And I'm going to go ahead and remove them from the screen now, and we'll keep talking about aftercare. Bye, guys. Thank you. All right, so I'm back here with Angie. So again, with our aftercare, we did the HA Copper Mist and the Growth Factor Gel. And these are the two you can use right after the treatment. For those of you that love MDPen serums, by all means, you can use those too. And one of my favorites for acne-prone skin or oily skin is the Tighten and Lift. And since we are talking about acne scarring and advanced treatments right now, I would recommend this too. So technically you could mist, do serum, and the growth factor gel. But when it comes to the open micro channels, this is going to be very important, the growth factor gel. For those of you that don't know what's in the Tighten and Lift, this is sweet almond green tea. It has a little bit of lactic acid. It's going to be hydrating, soothing. And even though lactic is an acid, it's an alpha hydroxy acid, and it actually does help with hydration. And even dry, mature skin types can use this product. I love this product so much. It's my gift to Angie. I'm giving her a big back bar size of this because I want her to use it and have it and love it. I want to ask you guys, have you learned anything in this video? What have you learned that you didn't know? I know a lot of you professionals, providers yourselves. Is there anything you learned about the EndyMed, the intensive technique, skincare, anything you didn't know before? Let me know in the comments because you will be chosen to win a Tighten and Lift serum. So just type that no matter where you're watching from, and I would love to select a winner for you guys. If you are interested in this device, please leave your email in the comments. There's also a place on our website. You can always set up a call with one of our professionals. They'll be happy to talk to you guys more. The EndyMed website itself is very informative too. And I have my bag. So this is our aftershave kit that we're currently advertising. It does come with this really nice toiletry bag. And that kit is going to have the HA Copper Mist, the Tighten and Lift, and the sunscreen. So it's a great kit for oily skin. Oh, Shay, awesome. So we do have someone here. Shay did not know you could treat active acne with RF microneedling. Absolutely. So Shay, they're going to give you my email. Please send me your information. I would love to send you a Tighten and Lift serum for you to try. Thank you guys so much for participating today. This event is recorded. You can always go back to your platforms and rewatch it that way. Again, we'll be doing a lot of EndyMed content in the near future. This was really geared towards advanced treatment for active acne and acne scarring. So I hope you have enjoyed this information, and I look forward to seeing you guys again soon. Thank you so much, Angie. I'm spending the whole day with Angie, so we have a lot to do today and go over. She has a beautiful, beautiful spa. Of course, today I'm at the Edgewater location, and again, they do everything here from pedicures, couples massage,
nails, facials,
microneedling, microblading, everything you could do. I want to come back and get a pedicure and a couples massage. And she carries all organic skincare. So totally love that. And you'll be seeing more of Angie's Serenity Day Spa. Her other office is in New Smyrna, which is pretty close by. So thank you guys. We'll see you soon. Bye.